You have to go back about 10 years ago. I was diagnosed with prostate cancer. It was caught early, appeared to be contained. It appeared to be sort of a moderately aggressive cancer. And then we talked about options. I tried to get an annual physical, and that was about it. I've been pretty healthy all my life and had never really had anything major until this. And when this hit, my immediate reaction is I was 52, and I'm like, wait a minute, I'm too young for this. But having, looked into it, a lot of men get prostate cancer in their 40s and in their 50s, and it's not unusual. But my dad passed away at age 59, and this was back when I was 25, and so I don't know if prostate cancer, runs in our family, but end of the day, it was what it was. It had to be dealt with. My son is 28 now. He knows when he hits about 40 that he needs to have his prostate, his PSA checked, and needs to start, watching it early. May never happen to him, but then again, the potential is there, and he just has a heads up. He's into that space, staying healthy and paying attention to what he eats and whatnot, and pretty much in a way that I didn't when I came along. But he's very much into that. My younger daughter is that way, and my older daughter is as well. So they've all, health is important to them. My wife's a pharmacist, so she's has had that inclination all along, and so it's kind of natural in our family to pay attention to health and to visit doctors and whatnot. What I've learned is that's not necessarily a typical behavior for all people, all families, and that's one of the things that we're trying to address with the Men's Health Initiative. Men just don't go to the doctors. It's just they wait typically until there's a problem, and by the time the problem's identified, your options may be limited, or it could be just too late. And a lot of the diseases, if you can catch them early, or you can prevent them altogether by health style, but if you can catch them early, you tend to be able to deal with them. And that's what happened in my case. Heaven forbid that I had not been going in for my annual checkup, and I found this 3 and 4 and 5 years later when I was actually having a problem. So one of the things of the Men's Health Initiative, how do we help men change that behavior? How do we help men think about going in and visiting their physician on a regular basis, so that whether it's cancer or whether it's heart, if we can change the behavior, then we can change outcomes. How do we change this behavior? And being the state university and being the state university hospital and research center, the medical school we ought to be leading this conversation. And that's something, we're here for the state of North Carolina. We're here only because of the state of North Carolina, and we're here to serve the state, all 100 counties. So what better way to serve our counties than helping promote health care for men? You start looking at men and families. Men in many families are the principal breadwinners. They're the head of the household. If they go down from a health standpoint and can't bring home income, that affects the families, that affects the communities. There's just a knock-on effect that just ripples. So keeping men healthy is awfully important. And so, it's obvious, but there's some subtlety here that I didn't realize about just men not being as attuned to going into to their physician as say women are. But it's like anything. Once you get educated, you learn, and it helps you define your thinking.
What are the top 3 to 5 things that all men should start doing today to get their health in line?
Well, if you smoke, you need to stop smoking. That's number one. That's what tackled my dad. He was a 3-pack a day guy, and that's just not good. I think exercise, walking, and so forth. Thinking about what the type of food that you put in your body. Making sure your weight's under control. And then you got the obvious things like taking your blood pressure and visiting your physician on a regular basis. I don't think there's necessarily a magic bullet, but I think there's just it's kind of a mindset thing. just making sure you're developing healthy habits is so important for North Carolina. The Men's Health Initiative is, I think, one of the most important things we have going at our hospital. And one thing that I think is very important, this is not an or statement where, you now promote men's health at the expense of promoting women's health or children's health or cancer and all the other wonderful things we do at Carolina. It's an and statement. We have to do all of these. And, you don't sacrifice one for the sake of the other. We have to figure out how we do all of these because it's important that, we have health for all our citizens. And so that one is one that I think is awfully important, that it's not an or statement. This is an and statement.
I love that. That's a good way to end it. Thank you so much for your time, sir.
Oh, you bet. Thank you.